Well, here in North Carolina, more than 850 cyclosporiasis cases have been reported since the outbreak started back in May. The parasite is typically spread through contaminated food or water and can cause severe gastrointestinal illness. Now, there are some concerns with deaths linked to the outbreak, and researchers, they are working now to pinpoint where all of it's coming from. Joining us now from Clemson University is Lesly Temesvari to break down some of the latest research. Thanks so much for being with us here today.
Thank you.
So we learned this week that 2 people in Michigan died in connection with the outbreak. Obviously very concerning for people all across the country. What does that tell you about how severe this outbreak is and the strain of cyclospora that we are seeing right now?
So what we learned from the Michigan health officials is that the 2 patients that died had underlying health conditions that were exacerbated by their cyclospora infections. Fortunately, most healthy people recover from a cyclospora infection. It's very treatable. The main concern with this infection is dehydration. Severe diarrhea can result in dehydration, which is dangerous, so it's important to stay hydrated. And I believe the Michigan officials said that this was the exacerbating factor in the deaths of those 2 Michigan patients.
Okay, as far as researchers, scientists coming to a conclusion of what may be causing this outbreak, where do things stand now? I know obviously this is very challenging. How close are they to identifying the source that all this may be coming from?
Yeah, so the original 15-state outbreak, federal officials linked it to shredded lettuce, which was recalled and removed from the market. But now 47 states are involved, and so there are multiple separate clusters that have gone unsolved. So for example, in North Carolina, there is a correlation between cyclospora infections and consumption of parsley and cilantro, but that's not confirmed yet. You are correct in saying it's very difficult to pinpoint the source because of the incubation period of this parasite. So the incubation period is the time between when someone is exposed to an infectious agent and the time they show symptoms. And unlike bacteria, which can make you sick pretty quickly, this parasite has an incubation period of 7 to 14 days. So the way officials pinpoint the source is interviewing a lot of patients. So imagine being asked, what did you eat 7 days ago, or what did you eat 14 days ago? It's difficult to remember, and that makes it difficult for the investigators.
All right, yeah, no, I can only imagine, unless you keep a food diary, it's probably pretty difficult for people to remember what they ate weeks ago. For those that may be concerned about how to prevent contracting it, what's your message to them?
Yeah, don't panic. Cyclospora is very treatable. Continue to eat fresh fruits and vegetables because that remains an important part of a healthy diet. Wash your fresh produce under running water. If it's firm enough, scrub it under running water. This could get rid of cyclospora if there's any cyclospora there. Stay informed about recalls that are made by public health agencies. And if you're experiencing diarrhea for more than a few days, visit your healthcare provider.
All right, some wonderful advice. Thank you so much. Lesly Temesvari from Clemson University, we appreciate your time.
Thank you for the opportunity.